Okay, let me go ahead and get started. Welcome to the next program. This is titled Healthcare, Education, and Women's Rights, the last 50 years. Thank you for coming to this dialogue. Also for the veterans in the room, thank you for your service. My name is Quốc Hưng Tran. I'm not on the list. Linh Nguyễn is on the list. She can't make it, so I'm filling in for her today. So if I didn't do this good of a job, then you blame her. Her name is spelled Linhnguen. Okay. I have her email address too, so. I am the coordinator of the Alliance for Vietnam's Democracy. I'm also on the steering committee of the Global Democracy Coalition. It's a coalition of 160 civil society organizations internationally. I'm a practicing child and adolescent psychiatrist, and I also have the privilege of treating veterans for the last 30 years. I'm a former member of the faculty at the UT Southwestern Medical School. So as we reflect on these three important pillars of development, healthcare, education, and human rights, we are reminded that these are not policy objectives. They are the very foundation of a just and prosperous society. They define how a nation nurtures its people, protects its vulnerable population, and equips its future generation with the tools to thrive. So today we'll discuss Vietnam's progress and challenges over the last 5 decades. We will also address the systemic issues such as corruption, inequality, and human rights violations. This conversation is not about identifying problems, even though there's a lot of problems. It is about inspiring meaningful changes. As global citizens, policymakers, community leaders, we share a collective responsibility to advocate for reforms that prioritize human dignity, equitable access, and justice. I think the last speaker spoke about peace, war and peace, and I think Alan White once said that peace without justice is dictatorship. So throughout this program, I encourage you to listen, reflect, and contribute to these discussions. Each speaker's we are very privileged to have them, brings unique insight and expertise that will help guide our understanding and strengthen our resolve to make a difference. As we begin, let us remember that sustainable development starts with our unwavering commitment to protect and uplift every individual. Together, we can envision and work toward a future where healthcare is accessible, education is empowering, and rights should be reality for everybody. So our first discussion will focus on healthcare, the progress made, ongoing struggles, and the future of public health. Please join me in welcoming Dr. Nguyễn Như Phúc to share insights into healthcare over the last 50 years. We have some problem with the slides, so he will not have his PowerPoints in the first talk. Dr. Nguyễn was the second lieutenant physician, military medical school unit of the Armed Forces of the Republic of Vietnam. Welcome.
Thank you, Dr. Tran. Good afternoon. Health and happiness is one of the United Nations Sustainable Development Goals, which aims to ensure healthy lives and promote well-being for people of all ages. While Vietnam has made some effort to improve public health, significant shortcomings remain. Several points. Non-communicable diseases include high blood pressure, cardiovascular diseases, diabetes, chronic lung diseases, and cancer, which are becoming more prevalent and account for 73% of annual deaths in Vietnam. The primary causes include unhealthy eating habits, such as excessive salt, sugar, fats, and alcohol, lack of physical activity, and unhealthy lifestyles, such as smoking and substance abuse. Rapid urbanization has also contributed to this trend as more people shift to sedentary jobs and unhealthy diets due to the convenience foods. Addressing this issue requires comprehensive public health education, national campaigns promoting healthier lifestyles, and improved access to preventive health care services. Public fitness facilities, community wellness programs, and initiatives to reduce smoking and alcohol consumption must be prioritized to combat this growing crisis. Secondary, substance abuse. Alcohol and heroin remain prevalent across cities, schools, and communities. Youth have shown a rapid increase in drug use, often linked to mental health issues, poverty, and lack of educational opportunities. Peer pressure and social marginalization also contribute to this concerning trend. Excuse me. Substance abuse leads to a ripple effect of negative consequences, including crime, family disintegration, and unemployment. Rehabilitation centers in Vietnam are often overcrowded and underfunded, lacking of effective reintegration programs. Moreover, action plans in preventive measures against drug abuse often remain superficial and not actionable. To address this issue, Vietnam must adopt evidence-based drug intervention program, strengthen community-based rehabilitation, and collaborate with international organizations to enhance training for healthcare workers dealing with addiction. For mental health care remains grossly neglected due to societal stigma and the government lacks of large-scale plans to support patients and their families. According to UNICEF in November 2023, 1 in 5 Vietnamese adolescents faced mental health challenges, yet only 8.4% had access to necessary counseling or support services. Moreover, only 5.1% of parents recognize their children's need for mental health support. The scarcity of mental health professionals, especially in rural areas, exacerbates the issue, with many communities lacking even a single licensed psychologist. Suicide rates among youth have increased in recent years, yet mental health awareness campaigns remain minimal. There is an urgent need to train more mental health professionals, establishing mental health clinics in schools and local communities, and destigmatize mental illness through public education campaigns. For elder care, Vietnam's population is aging rapidly, yet services for chronic disease management and healthcare support for the elderly remain inadequate. Many seniors, particularly in rural areas, lack access to geriatric care and depend on family members for medical support. Government support programs are insufficient, and many older adults live below the poverty line, unable to afford necessary treatments. Establishing comprehensive elderly care programs, expanding access to affordable medication, and developing home care services can help address this growing issue. Environmental concerns. Air pollution and climate change pose significant health risks. Water pollution results from untreated industrial waste, residential waste, and agricultural chemicals. Salinity intrusion in the Mekong Delta contaminates freshwater supplies across southern Vietnam. Additionally, pollutants like lead, mercury, cadmium, and other toxins exacerbate the environmental health threats. In urban areas, the high levels of fine particulate matter, PM 2.5, contribute to an increase in respiratory diseases, particularly in children and elderly. Addressing these environmental issues requires stricter enforcement of environmental regulations, investment in clean water infrastructure, and public awareness initiatives on waste management. Healthcare disparities. Despite some improvements, a significant gap in healthcare services persists between urban and rural areas, as well as across different socioeconomic groups. Rural areas often lack access to qualified medical professionals, modern facilities, and essential medication. In contrast, urban areas have better equipped hospitals and a broader range of specialists. This disparity is also evident in maternal and infant mortality rates, which remain higher in remote regions. Government policies must focus on the equitable distribution of healthcare resources, mobile clinics, and incentives to attract doctors to rural areas. Additionally, telemedicine services could help bridge the gap by providing remote consultations and follow-ups for patients in underserved areas. Corruption in healthcare sector. Corruption remains a long-standing issue that undermines public trust in the system. Some healthcare officials exploit their positions for bribery and personal gain. There are accusations of doctors and nurses requesting under-the-table payments for patients in exchange for timely or better quality care. Procurement fraud. Pharmaceutical and medical equipment companies have been implicated in bid rigging and inflating prices and diverting essential funds for critical services. Public distrust. Corruption in the healthcare sector not only strains public finances, but also erodes confidence in public health services. Patients often turn to private clinics even if they cannot afford it due to the lack of trust in public hospitals. Ladies and gentlemen, psychological well-being also encompasses human rights. Vietnam human rights record remains dire in nearly every respect. The Communist Party remains a political monopoly, suppressing any challenges to its authorities. Fundamental rights such as freedom of expression, peaceful assembly, association, and religion are severely restricted. Black and human rights activists are subjected to police harassment, travel ban, arbitrary arrests, and solitary confinement. Farmers and citizens lose their land for development project without fair compensation, and workers are forbidden from forming independent unions. Police frequently use torture and beating to coerce confessions. The criminal justice system, including courts, lacks of independence, often imposing long prison sentences on dissident and civil society activists based on fabricated national security charges. A nation's health extends beyond physical well-being. It also reflects the state of its freedoms and human rights. Strengthening public health in Vietnam requires not only investment in medical infrastructure, but also upholding human dignity and justice. Ensuring that people can speak out without fear, seek assistance when needed, and live in communities free from violence and coercion is central to creating a healthy and thriving society. Thank you for your attention.
Thank you, Dr. Nguyen, for that comprehensive analysis in the 15 minutes that we have.